Good morning, everybody. Today we are starting on the anatomy of the female reproductive system. If we want to know about cancer warning signals, now we have all gained knowledge. We should first know what is normal. Once you know what is normal and how a normal organ functions, then it is easier for you to think of new symptoms if they should arrive in your body, or you should realize you will be seeking medical advice early. That is the reason why I am starting with normal female anatomy. All diseases are not cancers. All symptoms are not cancer warning signals. They may mimic, but to know what is normal is the most vital thing. Coming to our female reproductive system, I am showing you a picture. This is to show you a cross section, a cut view, so that you will have a better idea of your pelvic anatomy. This is your abdominal skin. Then you have your abdominal fat. Then you have the pubic bone, which you feel, all of you. And behind that is your urinary bladder. This bladder is just in front of the uterus. So, the uterus, if you see here, that is I told you what is uterus previously, a pear-shaped organ. This organ is just close behind. There is no other structure behind it. Coming to the back side of the uterus, you see this is the ureter, that is the urinary bladder tube going to connect to the bladder. Then this is the rectum and anus. So urine comes here. You are defecating or passing motion via this passage, and this passage is called the vagina. Now, these three passages are close to each other. I am emphasizing on this because many symptoms mimic backache, which can be related to the spinal cord, or to the bladder urinary symptom when patient can have lower abdominal pain. This uterus, which is here, is 7.5 centimeters long, 5 centimeters wide, and it has got 3 layers. The first layer will be called as the serosa, and then you have the muscular layer, and then the mucosal layer. The mucosal layer, you see, it is like a canal. This is very thin membranous structure, and this is the thing which you shed every month once a girl attains puberty. This is the menstruation occurrence. Now, this portion of the uterus, the lowermost portion of the uterus, I have already told you is called the cervix. It is 2.5 centimeters in length. Now you see the cervical opening os, and then you see the vaginal passage. This passage is very important. I will detail to you later the common conditions which can be symptomatic. The vagina has a capacity to stretch, and this is the passage by which the baby travels, and then it comes out to the vulva. Coming to the upper portion of the uterus, you have 2 tubes. I told you this is a cross section, so you will be seeing the other tube on the other side. This is called the fallopian tube. This fallopian tube is about 9 to 10 centimeters. If you include the cornual end also, that is, cornua is the place where the fallopian tube gets fixed inside. And roughly you can divide it into 3 portions: the innermost portion, the middle portion, and the last portion. This tube can stretch. It is the middle portion, the medial end, and the middle portion. This is called the infundibular, and the last portion is called the fimbrial end. Fimbria means it has got hair-like projection, very tender. When it opens out, it is like a flower. I am emphasizing on this fimbrial end because this is the fimbrial end from which the ovary, when it ovulates, gets transported. Now, the most important thing, so this is the transport media, the road for transportation for the ovum to come inside, and this is called the ovary, a beautiful and almond-shaped organ described in our textbooks typically, and the shape also looks similar, and it is on either side. So you have uterus, two fallopian tubes on either side, and then two ovaries on the other side, each side. Ovary is suspended to the uterus by ovarian ligament, and similarly the uterus is suspended to the pelvis by a ligament called round ligament. Now this is all not strict, they move easily, they are flexible. So the fallopian tube has got beautiful movement on its own. It's like a peristaltic movement which you compare in the digestive system. So with that movement, the ovum is transported inside the cavity. Not only that, the fimbria has also got protective activity. Suppose there is infection from here downwards, vulva, vagina, cervix, uterus. From there, the infection can ascend and they can go to the fallopian tube. So, inflammation, it is not only the transport of ovum, the hygiene if it is not preserved. If there is sepsis or infection in common words, it can have a direct transportation and the tube can get damaged. And one of the reasons for the common pregnancy complication called ectopic pregnancy, a pregnancy not in the normal position, can occur in this fallopian tube. Now coming to the ovary, the ovarian structure has got two important components. One is the follicles, Graafian follicles, and the other is the stroma. And the Graafian follicles can range up to 30,000, and in the beginning, before birth, it can start from few lakhs and then it grows and then it wanes with age. The follicle, so many Graafian follicles are there. Not all are active at a time. Not all are going to be active throughout the life. But each month, once a girl matures, the follicle can develop, mature, the follicle can come out, travel, and with the hormonal imbalance, the two hormones, which I'll be talking later to you in the physiology, estrogen and progesterone, most important, they develop the follicle, it travels through the tube and then comes to the uterine cavity. When there is no fertilization occurring, the endometrium sheds and you get it at normal menstruation. So this is a summary of what every woman should know, because when you know it, you can explain to the child and it develops a better confidence in knowing itself. You develop the confidence, you are aware of your own anatomy, and in future you can avert many problems, including benign diseases, by early checkup and seeking medical advice. Thank you.